Good afternoon, and welcome to today's Fireside Chat, What It Means to Be Immune. I'm Dr. Wayne Teris, Care Compass Network's Chief Medical Officer, and I will be moderating today's session. Care Compass Network is a community not-for-profit organization. While we do not provide direct patient care, we do support improved healthcare delivery by convening and collaborating with over 160 partner organizations across a 9-county region of the Southern Tier. These include hospital systems, social care providers, behavioral health and substance use providers, skilled nursing facilities, and higher education systems. We felt it was important to address questions and concerns that have been submitted by community members regarding COVID-19 vaccines and immunity. And today's chat will feature panelists from both Broome and Tioga County. So let's meet today's panelists. Dr. Katie Holmes is a family medicine physician interested in preventative health care and care of underserved communities. She received her medical degree from the University of Massachusetts and completed her residency training at the Brown University Family Medicine Program in Rhode Island. Since residency, Dr. Holmes has been active in caring for underserved communities and looking for ways that family doctors can better address barriers to care and improve communication between doctors and patients. She has lived both in Costa Rica and in Spain, becoming proficient in Spanish. Currently, Dr. Holmes is serving as the Associate Residency Director for the Family Medicine Residency in Johnson City, New York, and spent this past year taking care of COVID-positive patients in the clinic and in the hospital. She has also spent time as medical supervisor in the state-run COVID-19 vaccine site in Johnson City and has served on the Committee for COVID-19 Vaccine Equity for the Southern Tier. Next, we have Dr. Jagraj. Dr. Rai grew up in South Bend, Indiana. He came to the Southern Tier in 1989 to start his residency in internal medicine. He finished his training in 1992 and joined an independent practice in Vestal. In 1995, the practice joined Lourdes Hospital. He started in administration at Lourdes in 2012 and was named president of the medical group in May 2019. He also continues as a practicing internist. Hobbies include golfing when time permits, of course, and working in the yard and the vegetable garden. Next, Christine Shaver, who is the Director of Program Operations for Tioga Opportunities Incorporated, a community action agency serving vulnerable individuals and families in Tioga County for over 55 years. She's worked with Tioga Opportunities Incorporated since 2013 and currently oversees the agency's aging services, family planning clinic, WIC program, residential housing facilities, and Section 8 housing choice voucher program. Got it. Christine earned her bachelor's degree in psychology and master's degree in education from Binghamton University. Although she grew up in Broome County, she's now a Tioga County resident where she lives with her husband and 2 children. In her spare time, Christine enjoys spending time with family and friends, reading, working on crafts and puzzles with her daughter, and family moving nights. So moving forward, I do want to notify the attendees that if you think of questions that we're not addressing during this session, you are free to enter questions into the Q&A if you're on Zoom or in the comments in Facebook Live, and we will track them. We'll try to retain a little bit of time at the end to answer those as best we can. So we're going to get started. We're going to have a conversation here and address a lot of questions that have been submitted by folks in the community. And I'll start with Dr. Rai. So Dr. Rai, there are a lot of questions, a lot of concern out there. Were the vaccines rushed? Operation Warp Speed. Were they rushed? Were they tested properly? What is the real issue here? And can you address the concerns that people have about that?
Sure. So first, Wayne, thank you for giving me the privilege of being here to answer some of these questions. I'm a fierce believer in vaccines, and every single patient I see, I will have a conversation with them about whether they've been vaccinated or not. And this is the one question that we get the most often. Usually it takes 3 to 4 years before a vaccine can be developed to the time that it's being put into patients' arms. So why were we able to do this in 11 to 12 months? And there's 2 main reasons why this was possible. Number one is, obviously the world was facing a global pandemic. So usually when a vaccine gets produced, everybody is in their silos. This company is trying to produce a vaccine before this company so that they can make the vaccine and market the vaccine, and obviously their shareholders get the returns for that. In this case, since the world was facing this pandemic, all of the labs across the world were sharing information. So once a discovery was made, whether it was in the United Kingdom, United States, China, India, this was not proprietary information. So everybody was able to advance their research together, not against each other. The other part of this is the most, again, the time that takes the longest is to manufacture the vaccine. In this country, we needed 600 million vaccines. Well, that doesn't happen overnight. So usually you want to make sure the vaccine is going to work before you start mass producing it. However, in this case, again, we were facing a global pandemic. So the government decided to say to each of the companies, except Pfizer. Pfizer did not take any money from the government, but I believe Moderna had $1.6 billion. So if this vaccine wasn't going to work, and they mass produced it, well, their shareholders weren't going to lose any money. So as soon as they were pretty confident that we had a vaccine that was viable, we started mass producing it well before any clinical trials had started, well before we knew it was going to work. Now, thankfully, the vaccine is both the Pfizer and the Moderna vaccine is 95% effective. And so that was, wonderful in that we were producing this, it became available, and we got them into patients' arms starting in December.
And, you mentioned that you ask every patient. I've actually heard it said that medical providers should make it the so-called fifth vital sign. So for those in the audience, temperature, pulse, respirations, it's the vital signs. And asking about the vaccine is actually a fifth vital sign at this point. Is that important? And one other question. Yeah,
if I could just expound on that a little. And, when I asked a question, it's not to be judgmental. I just want to make sure, because there's a lot of information. Okay, we're all on social media. There's a lot of information out there, and you need to go to a trusted source. And if your primary care physician or your physician is not your trusted source, then we got a problem. And that is, it's not like we are getting, $25 for everybody we send to the clinic to get inoculated. But, we have lived through this the last 16 months. Personally, I developed COVID. So I've been able to tell the patients what to expect and how this is going to run. But the thing is that I want to understand why. And one of the reasons is, it's still under an emergency use authorization. What does that mean? And why haven't we gotten past that? So once again, the FDA knew that we were up against a very short time frame. People were dying. We had to make sure that the vaccine was going to be safe. But at the same time, we had to move kind of quickly so that we could get shots in patients' arms. What I'm hearing, what I'm reading is the emergency use authorization probably will be lifted in July of, holy cow, that's in a week, right? I don't know when in July, but because they looked at the data, they saw that the preliminary data, and then as we get more data, right? So we started giving shots out in December. It's now June, almost July. I believe over 300 to 400 million doses have been given in our country. And there have been some side effects, but there is no vaccine that won't give you a side effect. But there was nothing on such a scale that they said we have to stop this. You could bring up the fact of the Johnson & Johnson vaccine. It was rushed, and this is why we had to put a pause on. Well, I'm going to take a contrarian view to say is that we were paying attention, and once those reports came out of potential blood clots, everything was halted until we could do a review. A very good review was done, and it was felt that I think there were 13 cases of women from the age of, I believe, 18 to 48 that did develop this thrombosis in the cavernous sinus. Now, again, that happened, but there wasn't, I think there was 6.5 million doses given at that time. So 18 women did get this. Now, I don't know the details. Were they on birth control pills? Were there smokers? But that's neither here nor there. My point being is that to say that, gotcha, yes, this is not safe, it was exact opposite. When there was even a hint that something may be off, it was stopped. We didn't give it. And, we did further research. Sorry, I talked too much.
No, you answered the question before I asked it, actually.
Okay.
But that's excellent. I'll also throw in that in a recent survey, over 95% of physicians have been fully vaccinated, and of the other 5%, half intend to be fully vaccinated soon or in the process. So I think that speaks volumes. So I'll move on, Dr. Holmes. And another question we get is, what is immunity? Like, people have asked, I've heard some people have been vaccinated and yet they're still turning positive and getting COVID. Well, how can that happen? And why should I bother getting the vaccine? So if you'd like to address that, that'd be great.
Sure. So immunity is a complicated thing. I'm not sure I'm going to be able to define immunity to everyone's satisfaction, but basically what our vaccines are designed to do is get your body ready to fight this virus off if you ever come into contact with it. And so ready to go to battle with the virus that you won't get sick at all. Or if you get sick, it will be very minimal symptoms. The vaccines, I think about, even this time last year and how scared we were as medical providers to think that now we have this revolutionary way to develop vaccines. It's actually really a miracle of medical science and will improve all of our lives collectively, I think, in many, many different phases of our lives for years to come. But basically, you can, no vaccine we develop is going to be 100% effective. So these vaccines are honestly the best I've ever worked with in my whole career as a physician. 95% effective, but that still means 5% are not as effective. And I'm speaking here specifically of Moderna and the Pfizer vaccine. What does that mean? What does that 95 mean? That means if I give 100 people a shot, 95 won't get any symptoms of COVID. 5 people may go on to test positive or develop symptoms of COVID, but 0 of those people will go on to die of the illness. And the Johnson & Johnson vaccine is a little bit less effective than that, depending on what series you look at, which country you lived in. It's anywhere from 76 to 86% effective for getting any symptom of the illness at all. But 0 people die from getting the Johnson & Johnson vaccine. 0 people die of COVID. So, and I can tell you, having worked in the hospital, I have seen this in real life, that people who have been vaccinated, if they're in that unfortunate percentage that go on to develop the vaccine, I send them home. I didn't do that in January. I did not do that. I did not send those folks home. So really, this has been a miracle. It's been letting people go back to their families. It's been watching them get up from the ICU bed. It's been watching them get out of the hospital when that wasn't possible, even 2 or 3 months before. So I hope that has answered your question. It's worth it. The 0 number is really the number you're looking for. You get the vaccine, you don't die. That's, you couldn't ask for better than that.
Exactly. And one other thing, people obviously are concerned about side effects. So there's a system called VAERS, It's the Vaccine Reporting System, CDC. And some folks who have concerns point to this and say, we're not being told the truth. Look at all these things that this vaccine has caused, and we're not being told about it. What's the story? So what really are the side effects, and what about the VAERS system? There might be some idiosyncrasies here that we need to address. because I think there are some nuances that people don't understand fully. So Dr. Holmes, would you be able to address that?
Sure. So, as Dr. Rai had mentioned, we are all collectively, as the world, still learning a little bit about both COVID and this vaccine. But really, over 300 million doses of the mRNA vaccine. So these are the vaccines from Pfizer and from Moderna have been given in this country alone. And then many more millions have been given worldwide. And I mean, rarely have we seen such an effective vaccine. I also can't imagine a more safe vaccine. I've given it to extremely frail people. I've given it to people with extremely advanced cancer, multiple health problems. They've done fine. The things you can expect, a sore arm. Some people do get a little symptoms, like they might have muscle aches or fatigue. I know my husband developed a low-grade fever on that second dose, which is uncommon. People can get that as their immune system really ramps up to fight off the virus. But in terms of serious side effects, we've really not seen any from the mRNA. Dr. Rai already brought up that small percentage, or it's not even a percentage, that small actual number of people with the clotting problem. And we're still learning more about that. But in this country, we're very serious about medical safety, and anybody from you or my grandma or my son with technical savvy can log into this vaccine adverse reporting system and say, hey, I got this vaccine and now I'm walking backwards, or I had this vaccine and now I can't stand on my head, and 24 hours ago I could stand on my head. The key is that those are unverified, so anybody can put anything in there. And then scientists will comb through that to see, hey, is there anything we should pay attention to here? Are there any things that keep coming up and that we really need to figure out if it's connected to the vaccine or not? And that's where you see that you'll have these bigger inquiries, these bigger groups of scientists who will maybe even put a pause on something, or at least take a really close and hard look at that. Dr. Rai can correct me, but I haven't seen anything at all that makes me worried about these mRNA vaccines. I think of them as miraculous and very safe.
I would just kind of emphasize exactly what Dr. Holmes is saying. Some years our flu vaccines are 35% effective. Some years when we hit it right, we're 65%. The literature that I'm reading is that perhaps as soon as this year, our flu vaccine will be an mRNA vaccine, which means that the efficacy is not going to be 30% or 50% or 70%. It's going to be in the 90% range. And just, to elaborate that on that, now, mRNA vaccines, it's difficult to kind of explain this, but just to say is that every virus does have a signature feature on its surface that will kind of trigger a patient's immune systems. So our scientists in this country are amazing. We map these features, and then the mRNA vaccine will provide the blueprint to kind of act as a defense system that will help your body protect itself when it encounters the virus. So once your body has this blueprint, it knows exactly what to do. It reads the mRNA strands. It builds a defense against your virus, in this case, the coronavirus, and it produces proteins called antibodies. And these are they get sensitized. So next time, or if there is a time, your body encounters this coronavirus, the spike on the coronavirus, then it will it's in its memory, it activates these antibodies, and boom, you may get a little bit of a sniffle, you may get sick for a day or two, but it'll be nothing like ending up in the ICU, isolated, where you are kind of away from your family, watching them via FaceTime. So, it's much like the flu shot where, if you get a flu shot, it doesn't mean you can't get the flu. But if you've had the flu shot and you get the flu, basically we tell our patients is that you will have the flu for half as long and it'll be half as bad. So this is just taking it to the next level.
You know, we want to be sensitive to the needs of folks in the more rural areas. You know, a lot of Broome is more urban, but we also, you know, we have Tioga County in the southern tier, and a lot of it is more rural, and we want to be sensitive to the needs of the population there. And so I'm going to ask Christine a couple questions, particular to the more rural areas or particular to Tioga County. You know, why do you think the vaccine rates are so low there, and what issues are you hearing, and how can we help folks and address their concerns and the concerns in your county?
Sure, that's a great question. I wanted to start by thanking you for inviting me to participate in the panel today. I'm happy to talk about the issue from the perspective of a community-based organization. So your first question, why did the vaccine rates seem so low in Tioga County? I was able to pull up some data from New York State Department of Health as of June 17th. So these are likely a little bit higher today, but just to give you a little bit of perspective there. In Tioga County, New York State Department of Health is reporting that 41% of our population, of about 55,000 here, have had at least one dose of the vaccine, compared to New York State as a whole, where 58.3% have had at least 1%, at least one dose. So we are showing up as slightly lower than, you know, the average. I've spoken with our local public health department here, which is a wonderful resource for information of all things COVID vaccine related. And what I've been told is that some of our residents here in Tioga County have went out of the state to get their vaccine. We have the Guthrie Clinic right over the border here in Sayre, and many of our residents did go into Pennsylvania to get the vaccine. Their vaccination records were not uploaded to the same database that all of our, you know, those who are vaccinated within New York State were. So that's resulting in numbers that look slightly skewed. So our numbers here in Tioga County are higher than what it looks like on the New York State Department of Health website. You also asked about certain barriers or challenges that our population has. So being that we are a rural population, we've seen some significant challenges with things like transportation. Tioga County does not have a public transportation bus system. So that's been a barrier for a lot of our residents in traveling to and accessing the vaccine. In the early days of the COVID vaccine release, most of the appointments required registration online. A lot of our folks out here either don't have internet access where they live, that could be the issue. They might not have a computer or have the knowledge of how to navigate those websites to register for an appointment. So there's a lot of things that can be done to address some of those barriers. And luckily, over time, a lot of those have kind of resolved themselves. As far as the online registration goes, there are a number of different organizations that are happy to offer assistance with registering online, which in today's world is not necessarily required anymore. With the wider availability of the vaccine, we're seeing walk-in appointments readily available to our population, which has been an enormous help. So we are encouraging anybody that calls us to visit their local pharmacy. You can simply walk in and get the vaccine. So it's not as, you know, that challenge isn't there, that barrier. If somebody does want to register for an appointment online to ensure they have that time when they get there, Tioga Opportunities is happy to assist with that type of registration. In the early days of the vaccine release, we registered many individuals for online appointments, and we certainly can still do that. We've seen the frequency decrease quite a bit as those walk-in appointments have become available. Transportation still is a concern. If individuals can't get to that walk-in appointment at the pharmacy or to a scheduled appointment, it's still a barrier. There's lots of resources available, even in a rural area like ours, to get there. Not to keep plugging my own organization at Tioga Opportunities, we do have a volunteer transportation program. for older adults and people with disabilities. We're happy to help arrange transport to get to that vaccine appointment. If we aren't able to, due to volunteer availability, we work closely with the Get There call center from the Rural Health Network. They are a wonderful resource in helping to arrange transportation as well. I've been told that Uber is offering free transports to COVID vaccines. So that's a wonderful resource to utilize. Free rides to COVID vaccines for each leg of the trip, up to $25 for each leg. And then the other piece of that, if somebody really cannot leave their home, if you truly have a homebound individual, what do? You know, is that something where that person can still access the vaccine? And luckily, we are seeing some moves to being able to offer vaccines to homebound folks as well. Here in Tioga County, our public health department is working with local EMS squads and healthcare providers to help those folks in their homes and their caregivers. And in Broome County, the public health department is working with the local office for the aging to get people on a list for those homebound folks to still have access to the vaccine. So we're addressing each of those barriers as they come up. It's taken a lot of innovative thinking outside the box, but we're really doing our best to ensure that everybody has access.
I'm on mute. Okay. I do have a live question, which relates to, is consistent with some questions that you received beforehand, but I have a live question from the Facebook chat. And it says, I have a 13-year-old with a heart condition, and I'm worried about giving him the vaccine. I don't have a regular doctor. Who do I talk to about this?
Well, I'll start, but if either of our physicians on the call want to add to that, that'd be fine too. What we would certainly recommend, if somebody doesn't have a regular doctor to speak to, they could always speak with a pharmacist perhaps. We would also direct them to the public health department, both of which are good resources for more information to make the best choice for your family.
I've worked also in the vaccine tent, and this is a great question. So thanks for whoever chimed in. Oftentimes, maybe not at a local pharmacy, but definitely at the state-run vaccine sites, there is likely to be a healthcare professional, a doctor there who you can ask questions about. I mean, I've spent several days there. People had wonderful questions, really good questions, and I was enjoying answering them. People were being very thoughtful about it. I mean, certainly, I'm not sure where you're located in Tioga, but I know there are some primary care offices that do have some openings in, at least in Owego, which, you know, you could also just call. I think primary care doctors, I'll speak for myself and my colleagues, are very eager to talk to people about this. We would like to have a conversation with you, not like Dr. Rai was saying, because we want to judge you. We really want to understand what's going on. What's your worry? What's your fear? How can we help? How can we give you the information that you need to make the best decision for your family, for your family's health? And so I'm sure even if you're not established as a patient, you know, you probably can talk to somebody about that in those various areas. That being said, I'm a family doctor, and I would say that there's very little that would prevent me from recommending a vaccine to a teenager in that age range. The teenagers are doing remarkably well with the vaccine. Their bodies are young and healthy, and they're mounting an incredible immune response and have better rates than the adults. And certainly, I mean, without knowing any details, if I was speaking generally, I'm really recommending any child or teen with a chronic health problem to definitely get vaccinated to prevent, you know, more serious complications from COVID.
Okay, I'll move back to Dr. Rai. And so you already did address, you know, it's not the same as the flu vaccine, but the same technology may be used eventually. But people have asked, can the vaccine give me COVID-19? And can you address that?
Certainly. So the vaccine cannot give you the COVID. And so, you know, you could certainly have some side effects, But as Dr. Holmes has said already, is that, these are minor and usually are self-limiting within 24 hours. We've been telling our patients to, take some Tylenol if need be. But as far as developing the coronavirus from being inoculated, I've seen no studies or no literature that is possible. Wayne, you're muted.
People ask about longer term safety, the joys of Zoom. People ask about longer term safety. And I think we've agreed from our previous discussion that, there were no shortcuts here. I mean, it was tested properly and developed properly. But that being said, it has not been around for a long time. So what's the history with vaccines in general, and what do we think about the potential long-term safety? Because I know a lot of folks have concerns about that.
And that is it's an important concern. And they are 100% right. We started giving out vaccines in December, so it is only now into June. But when you look at the history of vaccines in America, going back, to measles, mumps, smallpox, all of these diseases have been eradicated because of vaccines that have been safe and effective. This mRNA vaccine has taken it several levels above what some of the previous vaccines did. And so, by the fact that 300 to 400 million people have gotten, or 300 million doses have been given in this country, to say nothing about worldwide, and we're not seeing any kind of significant side effects or, people growing out another head or another arm. That's just not happening. So those concerns are certainly valid, but I do think that I believe in the FDA. The FDA is never knowingly going to cut corners, never knowingly going to rush out a product that is to be given to our population and the medical community, whether it is physicians or it is nurse practitioners or physician assistants. We demand to see the background, the research, the literature before we formulate an opinion. Yes, what the FDA and the CDC tells me is very, very important, but I'm also well qualified. I'm a scientist, so I want to see the data. I want to see that science behind it so I can, kind of formulate my opinion. Only then can I go to my patients who trust me as their physician and answer their questions. So there is a lot of trust in there. I think our system is set up. It's the best in the world. And I think this is why once we got these vaccines, we saw that they worked, we got them in people's arms, and we were able to get ahead of this very, very quickly.
There's another question that comes up, Dr. Rai, a lot. And what it is I had COVID and I'm better now. I don't need the vaccine. Why should I get it? Why should they get it?
Great question. So the simple, quick answer is that the immune response from the vaccine is much more robust than it is from having COVID naturally. And, there is some data now that says that those patients who have had COVID, they don't need 2 shots. You really only need 1. Now, we're not there to say that is definitive, but I think in the next month or so, we would probably be comfortable saying is that, you only need 1 shot, because what we're seeing sometimes is patients who've had COVID on that second shot, they're getting a very robust response, as Dr. Holmes said. And so, they may be out of commission for 2 or 3 days. But that is primarily the reason, because we want to give you the best immunity for the longest period of time. And correlate the follow-up question on that, well, what about boosters, right? So you hear, like I heard a webinar that the CEO of Pfizer was saying, yeah, everybody's going to need a booster. That may be a little self-serving coming from the CEO, but in the beginning, it did seem like by the fall, we're going to need a booster. However, I think the literature that I've read in the last 3 weeks is showing that the current vaccines are so good, even against a lot of these variants, is that we may not need a booster for a year or two. But that research is currently being done. By the fall period of time, we will be able to better kind of have an answer to the booster question.
And I know I've seen literature too to the effect that when one has both doses of the vaccine, it seems to have increased effectiveness against the new variants that are coming out, and that's a definite concern. I do have a live question from Facebook, and I think Dr. Holmes pretty much addressed this, but the individual said, "I had both doses in February, and now I have COVID. What are the stats?" And I think it goes back to what we talked about. These are not 100% effective. They're, depending on which vaccine you're talking about, 95%. Maybe 80% for the J&J, whatever the numbers are. So a certain number of individuals will turn positive or have some illness, but the thing is, you won't end up in the hospital and you won't die. And that's what's important that everybody should know. Back to Dr. Holmes. Is there any reason somebody shouldn't get the vaccine?
Very few. So if you're within, if you have gotten COVID in the last month or so, there's some sources, including the CDC, that say you want to wait between 60 and 90 days after your COVID diagnosis to get the vaccine. And certainly if you recently had your shingles vaccine, and there's a certain number, very small amount of other vaccines, if you've had them within the last 2 weeks, that you probably shouldn't get this COVID vaccine. But really, it's incredibly safe to get vaccinated. I've vaccinated people, as I've said, with very active cancer, with autoimmune illness, with multiple health problems on multiple medications. I really, even people with I know early on there was some concern that people might be allergic to the vaccine. I've immunized a lot of people with asthma or eczema or allergies, and they've by and large done incredibly well with the vaccine. So really, again, if you feel like you might be in that special population, please talk with a trusted healthcare provider or even your pharmacist. I mean, a lot of our local pharmacists have incredible experience now with the vaccine. So if that's someone you trust, please ask questions about, is the vaccine right for me? But there's very few people, I can maybe count on one hand, not recommending the vaccine. And I would highly recommend the vaccine to anybody who has a chronic illness. For sure, those are the folks who have really struggled in the hospital, is the people who have COVID, but also have a chronic health problem.
Yeah, and Dr. Rai, did you have? No.
I will just say is that, maybe 2 or 3 patients of my panel, they're just allergic to everything, right? And they have a significant response to no matter, even Tylenol. I have advised them after discussing with their allergist, because they're all seeing allergists. But like Dr. Holmes said, I can think of maybe 3 patients in my panel that I have said, probably not a good idea. You shouldn't get it.
Okay. And, other questions come up. For example, do they cause infertility? What about pregnancy? What about breastfeeding? Do you want to address that? Because these are legitimate concerns that people have.
Absolutely, especially so, depending on which side of the reproductive health spectrum you're on. I know a number, especially of some of my colleagues, and I do a lot of women's health and a lot of reproductive women's health. I know early on there was some concern about pregnant women getting the vaccine. And I am happy to report that all the data we have up until this point, and we have a lot of data now because of the millions and millions of doses given out worldwide, that this is an extremely safe and effective treatment to be given during pregnancy. For me right now, I'm putting it in the same pile as the flu shot. So when women are pregnant in my practice, I strongly recommend that they get inoculated against the flu, because pregnant women are at risk for worse complications from the flu, from getting hospitalized or having some other problem like pneumonia as a result of getting the flu virus during the winter. COVID is the same. Pregnant women do worse by and large with COVID than women who are the same age who are not pregnant. So I would highly, highly recommend that pregnant women, after discussion with their doctor, consider getting the vaccine. We also see that there may be some immunity of COVID passed through the breast milk with vaccination. That research is ongoing, but preliminarily we can say that it probably offers protection for their newborn who, won't be able to be vaccinated right away, but who would be vulnerable to COVID. So, and then, just of interest, actually, in my inbox, I get articles, news articles and research articles, and there was a small study in the Journal of the American Medical Society just this last week, which looked at sperm counts in men who have received the vaccine. Although the number of men participating was very small, it was done, I think, at the University of Miami, the sperm counts increased actually after the vaccine of mRNA. So there really doesn't seem to be any effect on fertility. If you're planning on becoming pregnant with a partner in the next year, I would highly recommend vaccination.
Yeah, and I'll just say anecdotally that I've known several pregnant physicians who were faced with this conundrum and researched it extensively, and every one of them got the vaccine. And I know at least one has an incredibly healthy baby, and they felt good about getting it. So
I have several patients right now who are pregnant and who I strongly recommended to get the vaccine, and they were very brave about it. Two of the three have also registered with the national agency that's tracking it. So their health outcomes will be tracked, which I also think is the bravery of people who are helping us all get out of this tough place that we've been in is really remarkable. But all three, I am happy to report, had minimal side effects and are doing wonderfully with very healthy babies on the way.
that's great news. I have a question that's sort of as a corollary of what we were just discussing in regards to who shouldn't get a vaccine. And individuals said, what if a person's previously had an anaphylactic reaction from a flu shot? Should that person get the vaccine, or do they simply need to be in a controlled environment? And I think that's a little bit of a complex question, but I'll let either of the panelists.
Yeah, that is a excellent question, and have to think about that. I would be, the technology is not the same. However, as a internist, I would probably want to consult an allergist before I gave a yay or nay to that, because anaphylactic. So, we have inoculated many people who have anaphylactic reactions to other medications, but we always do it in a controlled environment. We'll take them to the walk-in or to the ER, and just in case, because this is where a patient really says, I want this vaccine. And so we want to keep them safe. But in this case, I would call a friend, and that would be my allergist. Yeah.
Phone a friend.
So I found out about this recently because a patient of mine didn't have an anaphylactic reaction to the vaccine, to the COVID vaccine, but she did have a funny feeling in her throat, and there was some debate about what it was. Was it an allergy? Was it not an allergy? So I found out about this resource through the state. They have resources where people who would be at high risk can go. There is an allergist or a highly trained physician on site for who can deal with high level allergies, and all the medications are on site for dealing with a potential anaphylactic reaction, and you stay for a longer period of time. but she had a very positive experience there, and she accessed that through the state website, which I'm sure we can link everybody to. And it would be a high risk vaccine. And again, she was interviewed by a doctor prior to getting the vaccination, the second shot, and she had a wonderful experience, and it was very, very safely handled for her. And now she's part of the fully vaccinated crew. So it's a potential resource.
So I'll turn it back over to Christine. There's a few other questions that have come up, and you may have run into this in the course of your days through this, but some people have asked, well, can a business legally ask me about the vaccine status? Can I be refused services for not being vaccinated? Have you run into this?
We've definitely had people ask about that. I think that's something in the forefront of people's minds, especially when they're on the fence about, whether to pursue the vaccine or not. So the short answer to that is that private businesses cannot discriminate on the basis of gender, religion, disability. But other than that, they really can choose who they transact their business with. The example that we often give is that you might have seen the signs, no shirt, no shoes, no service. That's a business's choice to do that. Same thing with the vaccine. What I see oftentimes are the signs up stating, if you haven't been fully vaccinated, please wear a mask. I personally haven't come across an instance where anybody has asked to see proof of the vaccine. But then again, that is a business's right to ask that. In the event that somebody doesn't want to show proof of vaccination or hasn't been, there's certain accommodations that can be made. Perhaps it could be a curbside pickup, or if you're talking about a food service establishment. The other question that's linked to that often comes up is, well, isn't it breaking HIPAA for a business to ask me about my vaccine status? And no, it's not. HIPAA is something that is, our healthcare providers must abide by HIPAA. Personal medical information cannot be shared, but a business simply asking for your proof of vaccination or your, whether you've had the COVID vaccine or not, is not a violation of HIPAA. Look at our school districts. We have to prove vaccination status for our children to go to school. Again, that's not breaking HIPAA to ask that question. So that is something that we often hear from our customers.
The other thing we sometimes hear, and this actually goes both ways. So here in the Northeast, where a lot of people are getting vaccinated, we'll have people say, I'm really feeling the pressure from family and friends to get vaccinated. I'm just not sure yet. What should I do? But I also had some visitors from the South recently, and it's just the opposite. They actually have friends who were hiding the status that they went to get vaccinated because it was actually a stigma. So, culturally, it goes both ways. But I guess the initial question, people are really pressuring me, and I just don't know what I want to do yet. Do you have advice for these people?
That's another question that I've heard from our customers and even some of our staff. They're hearing from their family and friends, why don't you get the vaccine? You should get the vaccine. And while, we may be promoting that here today, what I would say to somebody that has that type of, hesitancy is to do their research. Talk to their healthcare provider, get the information that's going to help them to make the best choice for themselves and their family. If they don't have a regular healthcare provider, like we said earlier, talk to a pharmacist, contact your public health department. If you're receiving services somewhere, whether from the Office for the Aging or Department of Social Services, there's wonderful resources out there that can provide unbiased information that's really going to help you make an informed choice. In the meantime, if you haven't gotten the vaccine, if you choose not to, if you can't get the vaccine, we of course are still promoting all, the safety precautions. Wear your mask, practice social distancing, wash your hands. So in the time that it takes to do that research, it's important to maintain those safety protocols.
And there are, and I'll turn it over to Dr. Rye, a lot of stuff out there on social media, and some of the things you hear is it'll make me magnetic. The vaccine will make me magnetic, or microchips are being inserted so the government or somebody can track me. And people, it's out there and people are legitimately concerned. How, when you talk to your patients, how do you address these concerns?
So first of all, you do active listening. You don't judge, and you want to just, understand where are they getting this information. But as we've said now several times, is, you got to reach out to the people you trust. Okay. And that is your healthcare providers, your pharmacists. You're going to see your pharmacist a lot more than you're going to see either me or Dr. Holmes, because you're going in to get your pills probably every 30 days. And you just kind of want to redirect them to the science and the history and explaining the why. And I get it because, in our country in the past, especially with the minority community, there's a significant distrust of healthcare providers because of some of the history we have, and it's not history that we're proud of. But this is why you have to go to a source that you trust, and you have to ask these questions to try to sort out what is really true and what is not. I mean, we are not injecting truth serum by giving you the coronavirus vaccine. We are not implanting a chip so that we can monitor, all of your movements. If you have a cell phone, your movements are pretty well monitored already, whether you want to believe it or not, right? Because these devices, you get on the phone, you got all these towers, they can triangulate wherever the heck you are and where you've been. And so it just goes back to getting the facts from people you trust. And if it's not your healthcare provider, whoever it is that you trust that knows something about the science behind what we're talking about.
And I guess I'll ask Dr. Holmes too. Are there particular, in your experience with your own patients, and also now you had experience at the mass vaccination site, what resonates with people? What are the types of things you get asked? What have you been successful in allaying these sorts of fears? Are you finding there's still a tremendous amount of resistance? Or, what would you say to the folks out there who maybe are reluctant to even have a conversation with their physician? I think Dr. Rye hit it on the head. We want to be non-judgmental and we want to actively listen. And I would venture to say just about every healthcare provider feels that way. They're not going to pass judgment.
Yeah, I think I think people are afraid, and it depends on where your fear is coming from. You had mentioned already, Wayne, that 95% of doctors are vaccinated, and this is because our fear is coming from a different place, and I think back to the past year of my life. And feeling that sense of being helpless while watching people suffer from something that I wasn't in control of. I think, a lot of people who are reluctant or who have fears are coming from the same place. They don't want harm to come to them. They don't want harm to come to their family. And what Dr. Rye was saying about the way that medical teams and medical systems have hurt people of color is true, and it's real. To be able to acknowledge that and say, okay, but we're talking about something different is hard, and it's still something that I'm personally trying to figure out. I honor that part of you that's worried. I think that's smart of you given the history. However, I'm worried about you right now in this moment, and you and your family. And so I think for me, when I'm I don't even want to say effective, but when we can talk about the fear honestly, and then make a decision together about what to do, that feels like the most honest moments that I've had with patients around this issue. And caring deeply about the health of the community, caring deeply about the health of individuals. It's funny because I also have had a number of patients I've cared for in the hospital who have been told, this COVID stuff, it's a hoax or it's not that bad, and they end up in the hospital and it is that bad. And they say, well, I didn't know. And it's because we've had to keep people out so that they didn't get sick too. But there's this weird disconnect, between what we've seen and experienced as healthcare providers and then what you may have experienced out there in the community. And I think what needs to happen to bring those worlds together is a conversation. And so we both, both from the medical side, where we're coming from our own fears, and from your side as a patient, needing to talk through some of your real concerns. We both have to kind of be brave and step into the middle and meet somewhere there.
And we have just a couple minutes. So to the attendees, if you have any last minute questions, you've got a couple minutes to type them in. And Christine, I'll give you a chance if you have any other thoughts or insights from the community-based organization standpoint or Tioga County. Be interested in hearing that.
Sure. I think I would wrap up my piece of this. As a community action agency, and we also do serve as the local office for the aging here for Tioga County, we work with a lot of individuals who tend to be very vulnerable, who are living in crisis situations. So oftentimes there are other pressing issues that individuals or families have going on in their world. Where the COVID vaccine question whether or not to pursue that isn't always at the forefront of their mind. If they're concerned about housing or food or, those types of things. We've really made a significant effort to keep this information really at the front of our conversations with our customers, the importance of the COVID vaccine, just to, you're protecting not only yourself, but you're protecting those around you. And that's a conversation that we continue to have with our customers here. And I think that resonates with people. People want to protect their families. Thinking about individuals, I know we've talked about patients on the call here today that maybe are cancer patients and whatnot. But I think about, my child, or I think about my father-in-law who has cancer, and I want to do what I can to protect them. So that's really an avenue that we try to, kind of focus on in our conversations. Despite what the folks that we work with might be facing in their lives, this is still an important conversation to have. So I'm so grateful for this talk today and helping to get this information out.
Well, I'd like to really thank my three panelists. This was just an excellent and insightful discussion, and I hope those in the audience that might have had some hesitancy or fear have had some of that mitigated. But make sure and talk to your own healthcare provider. Talk to the folks that we discussed. That's really the caveat here. I will say also that the state has set up vaccine hubs, and UHS is the lead entity for our region, for the Southern Tier. For those of you who are computer literate, if you go to Southern Tier Vax, so it's like Southern Tier VAX.org, or go to the UHS main website, you can link to it, and there's a ton of information for you, including a little picture of each county. You can click on your county, and it will give you links to where you can get vaccinated. If you're not so computer literate, you can dial 211. And they can generally help you as well as all the other entities that we discussed today. So I hope everybody has a great night. If anybody in the audience wants to hear more from other healthcare providers and community organizations, we will be doing other chats similar to this, focusing more on different counties in our region, but nevertheless of general interest. So if you'd like to, you can go to carecompasscommunity.org and register for any of them. You're welcome anywhere. So I hope everybody has a good night, and thank you.